What's up, folks? This is Tim with Austere Medicine Consultants, and today we're going to talk about our thermal injury field kit. You've already seen our over-the-counter kit, you've seen our minor incident field kit. Well, today we're addressing potential for burn injuries while we're out in the field. Inside of our thermal injury field kit, you're going to find a variety of bandages, first of which is going to be hydrogel burn dressings, some hydrogel individual gel packs, some gauze pads, petroleum jelly bandages, compressed gauze bandages, and importantly, our transparent bandages, so like Tegaderm essentially. With that, when we're in the field, we're already in a dirty environment, and we all know to keep injuries clean, but it gets exacerbated a lot more when it comes to burn injuries. One of our biggest concerns with burns and field treatment is keeping them clean. Obviously, we need to stop the burning process from happening to the patient, whether that they fell into a campfire and they got burns on their hands, whether they grabbed a suppressor or a suppressor bumped them on their leg, what have you, right? We need to stop that burning process, so cooling it off and getting the patient away from the point of injury itself. But the biggest thing we need to take care of is the prevention of germs getting into the burn site. Because once we've compromised our outer layer in our skin, we are introducing the possibility for nasty pathogens to get in there and cause some havoc. So with that, the hydrogel is going to help a lot with like the burn process. It's going to help with some of the pain. It's going to keep things clean. I'm going to place this burn gel directly on the wound itself. And then what I'm going to do is I'm going to take some gauze bandages and I'm going to end up backing up the hydrogel with these. And then additionally, I'm going to use these transparent dressings. And what the dressings are going to be for is to completely seal off the injury. We want to keep the nastiness out. We want to keep the hydrogel in. And by completely encasing it in essentially an occlusive dressing, that's going to keep that stuff together in a nice package for us. When we are in the field, when we have an injury, that's especially a thermal injury, we want to get the person out of the field and to definitive care in a hospital or a clinical setting. There's not much we can do for folks that are burned out when we're out running around in the woods, or we're out camping, or we're at the range. We need to get them to higher care. This is going to help with that gap that we have to bridge. We're getting them from the point of injury, keeping it clean, and transporting them rapidly to a facility that they can get more advanced medicines. Critical burns are also something that is going to greatly dictate how much emergency we're putting into our efforts to get someone out of there. Critical burns we could talk about for quite a while. We could talk about burns for quite a long time. It's an entire block of instruction in trauma schools. If we ever get somebody with a burn on their hand, that's going to be a critical burn site. People that have third-degree burns, it's obviously going to be a critical burn. Burns that are around the face area, because what we worry about is inhalation burns and inhalation injuries. So if you have somebody with burns on their face, that's going to raise your index of suspicion of higher problems for the patient down the road. Burns that are over genitals, burns that are over joints, we want to get those folks treated and out of there pretty quick. Again, this isn't going to fix the burn. Burns are going to require quite a bit of ongoing clinical therapy to make full recoveries, especially depending on the severity of the burn. But this is going to give our patient that much more of an edge for long-term recovery efforts by keeping it clean. Again, I'm hitting this pretty hard. We have to keep the patient and their injuries clean because, again, once we've compromised our skin, we are introducing the possibility for nasty germs and bugs to get in there and get our patient sick, risk systemic infections, and we don't need to be introducing any of that. So we're going to prevent that by using what we have in the thermal injury field kit. So the Austere Medicine Consultants Thermal Injury Kit isn't a catch-all for any type of burns. There's going to be burns that are going to be out of your scope of capabilities to treat in the field effectively. What this is for minor burns, okay? Whether it's from second-degree burns to small third-degree burns, this is going to keep the injury clean and allow you and your patient to get from point of injury to more clinical definitive care outside of the nasty and austere environment. This is not meant to treat any and all burns. but this is definitely going to be something that you're going to be happy to have if the unforeseeable and unfortunate happens. At our steer medicine consultants, what we want to do is give you the edge to get out there and attack life with any of your training, any of your recreational efforts. Using our field kits gives you that edge over the inevitable and unforeseeable, because chance favors the prepared. And as steer medicine consultants, we are here to work for you and help you stay clinical in all of your life's endeavors.